When I was a kid growing up in junior high school and high school, I was very interested in sciences. My father was a physicist, and although I liked physics, I was drawn, however, to biology. So I did a lot of science projects in biology. I decided that rather than become a bench scientist, I could use my passion for biology by becoming a physician. Being a rheumatologist, I get satisfaction every day by seeing patients with chronic rheumatic diseases who come in debilitated initially and with treatment can lead productive lives, hold a job, take care of their family, and be involved in sports and other activities. But occasionally, I can feel almost like a cardiologist. I can actually save somebody's life. So the story I like to talk about is a man who I met in the hospital for the first time who had lupus for a long time with skin and joint involvement. But I was called in because he was febrile, he had low platelets, was anemic, and he had renal insufficiency with an abnormal urine sediment. The doctors thought that his lupus was flaring. I was concerned that it could be something else. So I went to the lab and I looked at his blood smear. And on his blood smear, he had these cells called schistocytes, which are broken up red blood cells, which are a hallmark of a microangiopathic hemolytic anemia. And this man had something called thrombotic thrombocytopenia purpura. I transferred him from the hospital that he was at to Fairfax Hospital, where that night he started receiving plasma exchange, and that saved his life. I see him now twice a year, and it gives me pleasure every time I see this guy. Well, autoimmune diseases, depending upon the disease they have, impacts it in different ways. Patients with rheumatoid arthritis and psoriatic arthritis, they have pain, they have uncomfortable skin problems, they have difficulty doing activities of daily living, they may not be able to hold their job. Patients with other diseases such as lupus, the disease can be even more severe and life-threatening. They can have renal problems, CNS problems, problems with their blood and heart. We as rheumatologists have the ability to treat them and have them lead normal lives.